Hello and welcome. I'm Dr. Jessica, and I've had the privilege of guiding hundreds of women through the many aspects of reproductive health, including birth control options. Today, we're diving into an incredibly important topic. What are the best birth control options? Choosing the right method of birth control is a personal decision and depends on a variety of factors, from your health and lifestyle to your family planning goals. In this video, we'll explore the most popular and effective birth control methods available today, discuss their pros and cons, and give you the information you need to make the best choice for your body and life. When it comes to birth control, there's no one-size-fits-all solution. What works for one woman might not work for another, and that's perfectly okay. Let's go through some of the most common and effective birth control methods, so you can better understand what's available and what might be right for you. The first thing I want to emphasize is that birth control methods generally fall into a few categories: hormonal methods, barrier methods, intrauterine devices, IUDs, and permanent methods. Let's take a closer look at each of them. Hormonal birth control methods are some of the most widely used options, and they work by altering hormone levels in your body to prevent pregnancy. The main types include birth control pills, the patch, the ring, and the injection. Let's go over each one. The birth control pill is a daily pill that contains hormones, estrogen, and/or progestin to prevent ovulation. This means no egg is released, and therefore fertilization cannot occur. It's very effective when taken consistently at the same time each day. Pros: highly effective when used correctly. Regulates your period, can reduce acne and menstrual cramps. Cons: must be taken daily, which can be easy to forget. Can cause side effects like nausea, mood changes, or weight gain for some women. Does not protect against sexually transmitted infections, STIs. The patch is worn on your skin, on the arm, back, or abdomen, and releases hormones to prevent pregnancy. You change it once a week for 3 weeks, and then have a patch-free week during your period. Pros: only have to remember to change it once a week. Provides consistent hormone levels. Cons: can cause skin irritation at the site of the patch. May cause side effects like headaches, mood swings, or nausea. The Nuva ring is a small, flexible ring that you place inside your vagina once a month. It releases hormones to prevent ovulation and is worn for 3 weeks, followed by a 1-week break. Pros: convenient, only have to think about it once a month. Doesn't require daily attention. Cons: some women experience vaginal irritation or discharge. May cause hormonal side effects like mood changes or headaches. The Depo-Provera shot, or injection, is an injection of progestin that you get every 3 months from your doctor. It's a great option for women who prefer not to think about birth control daily or monthly. Pros: highly effective when used as directed. Works for 3 months, so no daily or weekly action needed. Cons: you may experience irregular bleeding or spotting, especially in the beginning. May take several months for fertility to return once you stop the injections. As you can see, hormonal birth control methods are very popular because they're effective and convenient. However, they may not be suitable for everyone due to side effects or personal preferences. If you're looking for something with no hormones, you might want to consider a barrier method. Barrier methods are designed to prevent sperm from reaching the egg. These methods include condoms, diaphragms, cervical caps, and sponges. Condoms are one of the most accessible and affordable options for preventing pregnancy and protecting against STIs. They protect against both pregnancy and STIs, and no prescription is required as they are available over the counter. However, they can reduce sensitivity for some people and must be used consistently and correctly every time. Diaphragms and cervical caps are soft silicone devices that you insert into your vagina to cover the cervix, blocking sperm from entering the uterus. They must be used with spermicide to be effective. These can be used only when needed, so there is no daily commitment. However, they must be fitted by a healthcare provider and are less effective than hormonal methods, especially if not used correctly. The contraceptive sponge is a small, soft sponge that contains spermicide and is inserted into the vagina before intercourse. It is easy to use and no prescription is required. However, it is less effective for women who have given birth and must be inserted correctly and removed after use. Barrier methods are a great option if you're looking for something non-hormonal and if STI protection is a priority. However, they require consistency with use and in some cases might not be as effective as other methods. IUDs are small T-shaped devices that are inserted into the uterus by a healthcare provider. They come in two types, hormonal and non-hormonal, copper. Hormonal IUDs release a small amount of progestin to prevent pregnancy. They are effective for 3 to 7 years, depending on the type. They are highly effective, long-lasting, and don't require daily attention. They can also make periods lighter or stop them altogether. However, they must be inserted by a healthcare provider, and some women experience spotting or irregular periods in the beginning. The copper IUD doesn't contain hormones, but instead uses copper to create an environment that is toxic to sperm, preventing fertilization. It is effective for up to 10 years and is non-hormonal, so there are no hormonal side effects. However, it can make periods heavier or more painful, especially in the first few months. IUDs are highly effective and low-maintenance options, but they do require a visit to your doctor for insertion. They're great for women who want long-term protection without needing to think about it daily. Sterilization is a permanent method of birth control and involves surgical procedures to block or remove the fallopian tubes for women. Tubal ligation, often referred to as getting your tubes tied, involves blocking or cutting the fallopian tubes to prevent eggs from reaching the uterus. It is permanent and highly effective. However, it's a permanent decision, so it's important to be certain you don't want children in the future. Sterilization is a great option for women who are absolutely certain they don't want children in the future, but it's irreversible, so it's important to think it through carefully. When it comes to choosing the best birth control method, it really depends on your lifestyle, health, and personal preferences. Remember, there's no one-size-fits-all solution, and what works for you may change over time. I encourage you to have an open and honest conversation with your healthcare provider to find the method that suits you best. Thank you so much for watching. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. And if you have any questions or comments, feel free to leave them below. I'm here to help you. Take care of yourself and your reproductive health, and remember that you're in control of your body and your future.
Explore more resources in description of this video, and don't forget to like, share the video, and subscribe our channel to keep getting even more informative videos in future. Thank you from my core of heart for watching the video, and do explore the resources in description to put your journey on fast track. Stay safe.
Disclaimer. The content of this video is for informational and educational purposes only. Always consult with a healthcare professional or qualified fitness expert before beginning any exercise program, especially if you have any pre-existing medical conditions or concerns. The exercises demonstrated may not be suitable for everyone. Perform any physical activity at your own risk. The creators and producers of this video are not responsible for any injuries, damages, or health issues that may occur. Please use proper technique, listen to your body, and progress